The first presentation is going to be Daniel Wolfson. Daniel is at the American Board of Internal Medicine in the United States and has been leading a program called Choosing Wisely. It's a fantastic program where physician groups, specialty organizations have come together to say, in fact, we do overdo certain procedures, certain tests. We have gotten into the mode of just absolutely ordering by routine, and we as physicians can step in and change that. Leslie Thompson is going to talk to us about patient-centered care, and she's going to give us some fantastic examples from Canada about how we might think in a very different way about engaging patients. So first, we're going to welcome Daniel Wolfson.
Depending on where you're from.
Oh, my goodness. Are you okay?
Yeah.
So I want to outline what I'm going to talk about today. I'm going to talk about what is choosing wisely, as Maureen has talked about. I'm going to talk about many levels about choosing wisely, about the conversations between doctors and patients about unnecessary care. I'm going to talk about attitudinal change, about less is more. I'm going to talk about professionalism and the role of professionalism in this campaign. I'm going to talk about partnerships, and I'm going to talk about implementation and why this implementation should be different than other implementations, because it involves values and spirit, things that Don talked about. So Maureen already talked about what is choosing wisely. So I wanted to I do this with every audience that I've ever given this speech. And so I want you to stand. I really can't see you. Now I can. If you've seen if you've seen unnecessary care done in the last 6 months, could you please stand? Unnecessary care, wasteful services. Everybody's standing, by the way, almost. Keep standing if you've seen harm done through unnecessary care. When I did this to IHI in December, this is what it looked like too. So, you can sit down now, thanks. So we always talk about omission of care, but this campaign is talking about commission. Things that are done that are unnecessary. And when omission is done, we think, oh, we're going to be covered. We won't have to face malpractice. And if we don't do something, that leads to malpractice. Yet 30,000 people die every year in the United States, I don't know about your countries, from unnecessary care. And that's what we're going to talk a little about today. So choosing wisely is, at one level, about conversations between patients and physicians and supporting them in that effort. We partnered, and partnership is kind of a key concept with choosing wisely, I assure you. We are a very small foundation, and we've leveraged hundreds of organizations to do this campaign. Consumer Reports, a well-trusted name in the United States, a nonprofit organization who has gotten into healthcare ratings and comparisons, a trusted name, has done conversions of scientific clinical recommendations into lay language. On our side, on the physician side, the ABIM Foundation has sponsored communication tapes that you can see at choosingwisely.org under organizations. So we can have a conversation about what's necessary with recommendations that are not absolutes. This idea didn't come out of thin air. Howard Brody from New England Medicine, thank you for suggesting this idea in healthcare reform in the United States when there was talk of rationing and death panels. And thank you, National Physician Alliance, for providing a feasibility test about how we could go about doing this. But the basis of this campaign is about professionalism. Social justice. It is socially unjust to waste resources. It diverts from health. It diverts from education. It is socially unjust. Now, this physician charter, which probably none of you have seen, is the basis, the foundation of this campaign, and it is difficult for physicians to think about the primacy of the patient. I should do everything I possibly can for that patient, and at the same time have the notion of a just distribution of finite resources. But that is what we're asking physicians to do. We're asking to hold both and have the skills to do both and engage with patients about nothing that's absolute. Our recommendations, 300 of them from 60 specialty societies, are not absolute. It's a beginning of a conversation. And in fact, each one of those recommendations from specialty societies says, here are recommendations because they're questions for patients and physicians to have conversations about. And when you're the American Board of Internal Medicine or you're connected with the American Board of Internal Medicine, you can begin to think that this is a 21st century physician that has competencies in managing resources, in improvement, managing conflicts of interest. That's what makes this document unique, powerful, and the basis for what we do at the American Board of Internal Medicine Foundation. So, I put this slide up, and I think listening to Don Berwick's talk yesterday, this notion of relatedness, self-determination, in my estimation, is the root of professionalism and the behaviors associated with professionalism. Autonomy, competence, relatedness, experiences of connection and trust that allow for internalization, competence when people can provide relevant inputs and feedback. This is about intrinsic motivation. A lot of talk in the United States and in other countries about pay for performance, regulation, marketplace. Where's professionalism as a force for improvement? And that's what we're trying to do with the Choosing Wisely campaign. Everybody knows about PINK, about mastery and autonomy and purpose. Those are the things that we want to impute in this campaign. Physician leadership, proactiveness, not reactiveness. So, our notion of professionalism guided us in how we developed the recommendations. And we've received some criticism for the lack of standardization of the recommendations. They weren't bold enough. I don't believe that, and I'll show you some very bold ones. But we said to the societies, we're going to give you 4 guideposts, and these are the guideposts. But they determined the process. They already had quality and improvement. They already had guidelines. We weren't going to be the external force requiring them to do something. We wanted to engage them. This was an engagement strategy. So I didn't tell you in the beginning, I brought 10 Americans with me. They're coming on stage, but they're in the form of a video. 10 people talking about the power of professionalism in the Choosing Wisely campaign. Can you play the video, please?
Choosing wisely is leadership and partnership. Leadership by professional societies thinking differently about how we use resources, and partnership with consumer organizations and patients to figure out how to talk about it in a way that realizes the best of being a doctor.
It is bringing together the patient and the doctor using the same script and the same goals to achieve what we all want, which is better healthcare in America.
Choosing wisely is the right initiative at the right time and the right message for both physicians and their patients.
Choosing wisely is the profession stepping up to really identify the issue of overuse and unnecessary tests and procedures.
Choosing wisely is a great step forward in the leaders of the profession taking ownership for helping the profession reduce low-value care.
The Choosing Wisely campaign is helping us be the best, most ethical physicians we can possibly be.
Choosing wisely is the first giant step in transforming the U.S. healthcare system by focusing all of us doctors on what the medical evidence says delivers the highest quality of care to our patients.
Choosing wisely is an outstanding and powerful tool to help facilitate patient-centered decision-making and evidence-based medicine for our country.
Choosing wisely should become a fundamental conceptual approach to medical student education, resident education, continuing medical education.
Choosing wisely is a very important signal that the profession of medicine has taken responsibility for both the quality and cost of health care.
Choosing wisely is one of the most innovative, powerful campaigns in which physicians can take back medicine, take back accountability, take back the professionalism.
Choosing wisely is a great step that is quite innovative on the path of better patient care.
Okay. I hope you recognize some people there. Mark Smith is on the board of IHI. So here's some numbers, and we'll talk about these. But here's a slide that I think you can relate to. So I've talked all about America, and I haven't talked about, what am I doing here? Paris is wonderful, but what are you doing here? So we've had a lot of inquiries about Choosing Wisely. And last week, Choosing Wisely Canada started. Anybody from Canada? Congratulations. I have Wendy Levinson's card with me if anybody's interested in working with her on advancing Choosing Wisely in your country. But we've heard from the Netherlands. Netherlands are here today. Japan, the UK, Australia, Italy, Germany. Anybody else have a country that's interested in Choosing Wisely? Haiti? What country? Haiti. India. Where else? Spain. Brazil. Singapore. Why don't I know about you guys? You got to come down and get a card. Okay? Wow. And I think why it's happening is because you want to speak to physicians and patients in a different way, with a different kind of trust that maybe you haven't had. So this slide is not only to talk about the problem in the United States. I had an interesting conversation with the Aussies. I said, you have 8% GMP. We have 17. We're going to get 19 unless we do something. Why are you worried? Because if I go to 9, it's going to take away resources from education. That would be a big deal. And we know we have overuse. But this is America, and what physicians have control of is overtreatment, and we'll talk about that because that is one of our aims of this campaign, is to say that physicians own this problem. They own it with patients as well, but they need to be in partnership together. And they own failures of care, and they own failures of care coordination. And this is Don Berwick's slide, which he says, if you want to tackle a big problem like carbon monoxide in environments, you need to chop away at the problem. And we're chopping away at $200 billion. But I can assure you, we didn't frame that. We talked to physicians for over a year and a half in focus groups and polling, and that we talked about waste and overtreatment and better care. And we did not talk about cost. We did not talk about utilization. The campaign is about better care. But 42% of physicians believe that patients in their own practice are receiving too much care. And then who's responsible? And this is a JAMA article. Everybody but themselves is the answer. That's the number I want to change. 36%. I think that number is changing. Zeke Emanuel was furious when he saw those numbers, and he thinks this will only stop when physicians stop looking at others. 80% of healthcare expenditures physicians are responsible for. And 1/3, and I know this is a professionalism dilemma, 1/3 of physicians acquiesce to patients' requests for tests and procedures even when they know they're not necessary. And that's a very controversial thing, and I think it needs to change. And it'll change when the patient feels empowered with information about unnecessary care. And both patient and physician believe that less is better sometimes. More is not better all the time. So I want to tell you some stories. We're only 2 years. We celebrated our 2nd anniversary April 4th. And the first 9, I assure you, were courageous. Courageous in doing something that was totally unexpected. Physicians talk about what to do, not what not to do. They talk about what's usually in their economic best interest, frankly, not what's not in their best interest. And these did. These 10, and it caused a snowball effect. Our press was amazingly positive. We stopped talking about rationing. We stopped talking about death panels. And that's what we wanted to do. We want to change attitudes of the American public, the attitudes of physicians around use. So then a lot of people came in. So my story, and storytelling is really important to campaigns, as Don Berwick has shown us. I'm invited to talk at the American Society of Radiation Oncology. We stopped doing press conferences after 2. That was enough. And the specialty societies began to do it at their own meetings, their own national meetings, which was very good. American Society of Radiation Oncology calls me, says, what do you do when you get negative pushback? Hang in there, I say. So what are they going to do? They're going to announce that proton beam therapy for prostate cancer is no better than the alternative treatment and cost 10 times less after the capital expenditure of $110 million to build the unit. So they had me as the warm-up act because they were going to announce this at this meeting. And I know Don quoted a lot of people, but I'm going to quote somebody that's my teacher. So I'm at this meeting. I'm not a doctor, by the way. So I say the true professionalism is one who strips away all illusions to reveal a reliable truth in which the human heart can rest. So I said that and had no impact probably, but I think it did. Somebody got up, and we thought, here's the tomatoes, they're going to come, their fears are realized, and the guy says, I'm the last one to install a proton beam therapy machine, and that's a big expenditure, and I'm ahead of it. But I want to thank you for what you just did. Professionalism in action. But here's the consumer groups. So we didn't do this alone. We partnered with consumer groups. AARP, American Association of Retired Persons, produces a bulletin for 25 million people. We're on the front cover twice. Last month we were on the cover again. Wikipedia. I don't know where people are getting information in your country, but that is the biggest patient resource, and we have a fellow that corrects that and makes adjustments. And I'm going to go real fast now, okay? Because now I think it's about technical change versus adoptive change. And the one thing I want to leave you with, if you just approach this as a technical quality improvement, this is not choosing wisely. It's about values. It's about engagement of both patients and physicians in a conversation. So some of the largest, and I think I'm over my time. Am I not? I got my alarm on. I got 2 more minutes. So some of so this is how we put it. Simplicity is really important. Simplicity of a campaign is really important. 5 things. Be simple, be concrete, show emotion, have stories. That's what Chip Heath said at IHI 2 years ago. Preoperative tests were a big part of the Choosing Wisely. Use of radiology services, cancer screening, palliative care, end of life, OBGYN, proton beam therapy. Those were the highlights. This is what a translation looks like for Choosing Wisely by Consumer Reports, distributed by doctors, by consumer groups. Here's what health systems are beginning to implement this, and they're doing it in many ways. Clinical decision support, patient support, data feedback, QI in the hospital, systems with employers. Even the best systems, like Kaiser Permanente, are seeing overuse by 25%, doing what we have as academic detailing, talks with physicians. Here are grantees in 21 communities, going from grass tops to grassroots in communities across the country. Echo has this machine. This kind of sums up the campaign. It gave legitimacy and cover to people to do the right thing, to have conversations. It's not taboo. Remove waste now. Rekindle the professional human spirit and see the power of professionalism and the patient-physician relationship. Continue these conversations, build partnerships, choose wisely. Choose wisely. Thank you.